Good morning, students. I am Dr. Walter, working as an assistant professor in SNS College of Physiotherapy. So, today we are going to see a new video regarding the foot drop. So, what is foot drop? So, this condition we will be learning in the subject clinical neuro, and we are going to see what causes foot drop, what and all muscles, nerves are getting affected in this foot drop, and what will be the outcome measure, like what will be the physiotherapy management. All these things we will be learning in this video. So be attentive. Now we are going inside the video. Foot drop is also called as drop foot. Why it is called as drop foot? Because for the patients, while we are explaining to the patients, if we say foot drop, they cannot remember what type of condition they have occurred. Now, while we say it is called as drop foot, it will be a clear explanation for them. Now, this onto the physical examination, the front part of the foot will be lagging to lift. Okay, for example, consider this area is a foot. Now, it is going for foot drop. So now, if the patient is going for the foot drop, they cannot able to lift the front area of the foot. So how it will be? It will be looking like this. Okay. Now, the anatomy, nerves, muscles also involving in this foot drop condition. And we may think this is a major big issue, but with the physiotherapy management, we can able to overcome this disease. Okay, so it is not a disease, it's a condition. Okay, so the treatment of this will be discussed at the later part of this video. Now we are going for the next part, that is the causes. For each and every condition, there must be a cause. So what causes this foot drop? Now look at the slide. These are the muscles. Tibialis anterior, extensor hallucis longus, extensor digitorum longus. So these muscles are the most important muscles for holding the foot in a static position. Now, if these muscles are going for any injury, or the nerves supplying to these muscles going for any injury, it will go for the foot drop. Now we can see what type of nerve injury it is going. Before that, we can see, look, nerve injury or brain or spinal cord disorders, muscle disorders. So these are the other conditions which may cause the foot drop. Going for the nerve injury. Neuropathy. Neuropathy is something like, it is the used term nowadays. It is due to the damage of the peripheral nerve. Like, if we are dividing the nerves into two segments, central nervous system and the peripheral nervous system. Central nervous system is supporting whole of the brain and the spinal cord. Peripheral nervous system, it is associated and supplying to the other parts of the body. Foot drop is coming under the peripheral nerve injury. Now, what are the things which causes the nerve injury? Sports injury, diabetes. So diabetes is playing a major role in this foot drop. Hip or knee replacement surgery, and during the childbirth, and other conditions as follows. Okay, so if a surgeon is doing a surgery, if it is going for any complication, or else if the patient is going for a fall or the bone is going for a fracture, if it is disturbs the corresponding nerve, it will be going for the foot drop. Now, radiculopathy. Radiculopathy is going for the spondylolisthesis, and it is going for the herniated disc condition related to spinal cord. Now we'll go for the other conditions, that is going for the brain. Going for the next slide, that is the brain or spinal cord. Brain or spinal cord is going for stroke, cerebral palsy, and other conditions. If a patient is affected with stroke and all, we might have seen many patients with stroke. So these patients will be going for foot drop, and it is our role to manage the foot drop. Muscle disorders, muscular dystrophy patients, it will be affected with the small children, and in ages it will be affecting the adults. Majorly, male are getting more affected in this area. Symptoms. So what will be the symptoms? Increased incidence of falling while the patient is walking. Look, I am walking. If I'm walking, the patient will be going for falling. Why? Because foot drop is looking like this. They cannot able to lift their front part of the foot. In below terms, you can see difficulty in lifting one's toes. The front part of the foot is going for drop and they cannot able to keep another step. So these and all conditions is going for the symptoms. Inability to voluntary point the toes upward or move the ankle from side to side. Even side to side movement is also affected in this foot drop. Now going for the diagnosis. Diagnosis, how we are assumption like this is foot drop or anything other condition. How we are doing? Diagnosis going for X-ray, CT, MRI. So along with these things, you can see many things. Two major things are most important. One is NCS study, nerve conduction study. Second one is electromyography. These two studies are most important in the detection of the foot drop patient. NCS studies, we will be placing the needles, we will be recording into the monitor and how the muscle works onto the nerve stimulus. Same way, this electromyography is following. Now going for the last session, there is a treatment. Treatment, we know many other medications are there and many other techniques are there, but we are concentrating onto the physiotherapy management. Physiotherapy management, first we need to support the foot drop. How we can support? With the foot drop splint. This foot drop splint will maintain the drop foot to a nominal position. Okay, and other techniques, what and all other techniques we can use in physiotherapy? We can use the range of motion exercises and balance training, and all these things will be helpful in the physiotherapy management, and corresponding treatments are as follows. So students, so today we learned about the foot drop and causes, symptoms, diagnosis, treatment. So learn these things. If you are having any doubts, just ask me, I'll let you know. Thank you.